So you may have heard that I have been doing a series of wellbeing workshops. I started in March and we are going all the way through to July. Now, the ADHD Women's Wellbeing Workshop series is happening as we speak, and you may have missed a few of these fantastic workshops, but do not worry because they are all available on my website, so you can watch them back and you can book onto any new workshops. So we have coming up rejection sensitive dysphoria workshop and how you can help yourself. We've got boosting your self-belief and self-trust after a late in life ADHD diagnosis. We've got something called creating ADHD routines and structures, in inverted commas, by the way, and it's creating more calm in these choppy waters. So how can we develop our own routines and structures that feel good to us? And I'm also going to be doing a workshop on compassionate ADHD families and parenting and relationships. I'm really looking forward to that. And then I've got, if you've joined the All Access Pass, so you can buy the All Access Pass now, that means you get all the recordings, you get the reminders, you get everything. You will then be able to join me on my Ask Me Anything bonus workshop. This is being opened up to anyone who has pre-ordered my book or has joined the All Access Workshop Pass. All the information is on my website. It's adhdwomenswellbeing.co.uk. I'm adding all the recorded workshops onto the resources area of my website right now. And I promise you, each one you'll get a different takeaway. I put so much energy and so much effort into these workshops because I'm desperate for more people to have better self-understanding, self-awareness, but also self-compassion so they can understand themselves and their ADHD better. So I really hope to see you there, and I'll put the information as well on my show notes. Here's the rest of the podcast. Hi, and welcome back to another episode of the ADHD Women's Wellbeing Wisdom, where I bring back to you conversations I've had previously because I find them so important and more poignant than ever. And today's episode is no different. I've got Professor Sandra Kooij here, and Sandra is fascinating because she is dissecting and understanding the most up-to-date research and evidence of women's health, hormones and neurodiversity. She works understanding about heart health and neurodiversity, and she's spearheading so much more research in this area, desperately needed research. She is the Professor of Adult ADHD in Department of Psychiatry in Amsterdam, and she started in 1995 with the research and the development of diagnostic assessment and treatment of adult ADHD in the Netherlands. And since 2002, she's been the head of the Dutch Expertise Centre of Adult ADHD. She has been dedicated and involved in research, treating patients, educating professionals, and informing the public, publishing books, scientific papers, websites, webinars, and podcasts, and now has a new ADHD app as well. So what we're understanding here is that Professor Sandra Kooij is someone who understands ADHD from a time perspective. She's been there, she's been understanding, researching for such a long period of time, and what she knows are the nuances and the interplays and the many layers and fabrics of how neurodiversity, especially in adult women, can show up. She focuses on this overlooked interplay between estrogen and dopamine and its impact on women with ADHD. We're going to talk about this in today's episode, the historical research in this area and how ADHD symptoms can worsen during times of lower estrogen. So we're talking about, before a period, after childbirth and during menopause. And she's going to explain to us a little bit about the real world clinical observations and the emerging treatment areas, from adjusting stimulant medication to considering more hormonal support. I really hope you find this episode as fascinating as I did back when I recorded it. I can't wait to share this more condensed snippet here because I know that this is very much needed in our community. Here is my conversation with Professor Sandra Kooij.
If you dive into the literature, there's nothing about ADHD women at the time. There was nothing about interaction of hormones and neurotransmitters, what I suspected. There was very few studies about dopamine and estrogen interaction. That was the most interesting part that I found, because estrogen proved to be like a neurotransmitter. It's a hormone doing things for our female organs and so on, and we all know that, but it's also a compound that works into the brain directly with dopamine. And dopamine is the compound we need to pay attention, to be organized, to be able to plan, to make decisions, to be quiet and having control over our emotions. And estrogen basically does similar things for us. So we have two hormones or two neurotransmitters, if you like, that do the same. If you have ADHD, we assume that the brain is suffering from a low dopamine level. And when your estrogen drops in the last week of the cycle, or after giving birth or in menopause, you have twice nothing to control your behavior, your feelings, your cognition, your memory. You are not able to fulfill any task that you intended to do in that week, and maybe a bit longer. So it's really understandable. And women were so enthusiastic when we wrote this down and gave webinars about it, because they said, there's an explanation for us. We are not stupid. We are not crazy. It's not our fault. There's a biology behind it. Well, of course, I cannot measure it, but I hypothesize that this can be a good explanation. And if that would be true, we cannot measure estrogen in the brain or dopamine in the brain. We cannot. It's not possible. We cannot even use hormone levels in the blood, because it's not reliable. It doesn't say anything about symptoms. So there's no correlation between the level of estrogen, high or low, and your symptomatology. So that's not a way to go. But we can confirm this hypothesis by using medications that increase estrogen levels and or dopamine levels. And if that's true, women should improve with one or the other or both. And actually they do. So although RCTs are lacking still, I can tell you what I learned from clinical practice so far and from a case series that Maxime de Jong recently published. What she did was monitoring what women with ADHD are doing already themselves, because they find out it's helpful. And this is a little increase of the dosage of stimulant medication in the premenstrual week. And this is very helpful and it's easy. But you need to discuss it with your doctor, because your prescription will be finished earlier and she needs to understand what you do with it, he or she. But we measured blood pressure and pulse and mood and sleep and everything in those 9 women only. And they all were happy and wanted to continue every month in the premenstrual week with the increased dosage. So everybody who's interested can read it. It's on PubMed, so everybody can read what we did, how high the dosages were, and what the women reported. So that's good news. Of course, it's not RCT, it's not randomized controlled trial, what we need to do to prove it. And then you give women a placebo versus this increased dosage. The other way to go would be increasing estrogen. This can be done with the pill continuously. So no stop week, because in the stop week you drop your estrogen again to get this withdrawal bleeding. That's normal. But in this case, you can continue to take the pill, which is not dangerous at all, in order to limit the chance of getting symptoms again due to drop of estrogen. And for some women, this is also helpful. We don't know yet for whom which one is best, increasing the dosage of the stimulants or the continuous taking of the pill. This should be studied. This is next. The other way is our 3 options now is the SSRI, the antidepressants. They have been studied in PMDD for a long time ago, and they have been proven effective for improving the symptoms in the last week. So you can even take it shorter than the whole month. You can take it 2 weeks because the effect of the antidepressant starts earlier than with normal depressions. And maybe because the fluctuation of the hormones have impact on that. We don't know exactly why. But it means that serotonergic medication, dopaminergic medication, and hormones interact, which we said in the first place, but also that serotonin can have influence on this process. So we have not one, but 3 options now, potentially, which is good because not everybody can use every medication. And sleeping enough and having a healthy lifestyle and so on is very nice for people who can control themselves, but not in this week.
Absolutely.
for women with ADHD. So it's kind of cruel. It's kind of a cruel treatment option to tell them that they should behave better and take care of themselves. And of course you should do that, but it's not possible. So it's not a way to go. And so I think medicine should think of better options and understand why this happens. And if you understand why this happens, how it happens, you can invent the right treatments.
Yeah, absolutely. And I think what you said then about just saying, right, or just sleep better, or just have a bath and, you'll be fine. I've heard this as well. I've done some research in my community about 300 women, and I asked some different questions. And I would say every single woman, the question of hormones and how have they impacted you and how's it shown up, every single woman had a story. So that's 300 women all saying, I've either had postnatal depression, severe PMS or PMDD, suicidal ideation, anxiety, depression towards the end of my period, like anything. Not one of them said I've been absolutely fine. I'm sure you understand this, is that as women, we've all got our hormones. They all fluctuate in very different, unique ways. And then with ADHD, we're also fluctuating and it shows up in very unique ways as well. So to be able to find something that works for both our hormones and both our ADHD is a very very highly sensitized dance, isn't it? And then things change. So something that could work for me at 40, at 50, I might need something totally different. And then we have to bring in all the medication and all of that. And so I'm just saying that to validate to anyone that's listening here going, I've still not found that dance that works for me. But at least now, with your research and what you're bringing to the table, women have got more options. We're able to say, if that doesn't work, let's try this. And if that doesn't,
Yeah. But what you say is true. And research recently showed that women with ADHD have earlier menopausal onset. And this is completely unknown in the rest of the world, except among researchers now, because it's only one study showing that. And this is a genetic thing. So there is something that's in your genes that tells that time has come to stop making eggs and lowering your hormones. It's not in your advantage because your bones will lack estrogen for being dense. And the fractures that come when you are 60 are ahead. So you must be protected from an early age, earlier than anybody else. And it's not known. So that's dangerous for women with ADHD. And it means that when you're, for instance, you're 44 and you're having PMDD, severe PMDD, in the week before menstruation, your PMDD may increase by advancing during the cycle. So first it's only the 3rd week, then it starts in the 3rd, and then the 2nd, and then it's the whole month, and then you think, I'm getting crazy, I can't cope. So this could be an indication of early menopause in women with PMDD. And of course, there's no underpinning for this, but that's logical thinking. Because estrogen drops, and so you will earlier and earlier in the cycle get more depressive symptoms, cognitive complaints, anger outbursts, and whatsoever. So this is a group I worry about, because if you do not start early with HRT, you may get unresponsive to hormones. So the ovaries and the brain are not forever open for hormonal influence. It stops after a few years. So it's necessary that we learn. It's necessary that women know, but especially the GPs who prescribe the hormones. And this is a problem because they don't know it. But awareness often comes from patients. So I trust you that you will help.
Oh, yeah.
But doctors don't believe women who wander on their doorsteps and claim things. So we should publish for you and do more research. And we do that. We will do that.
And we're grateful. I mean, 100%. I've heard this through so many women that I've spoken to, that their perimenopausal symptoms have started and they've just questioned it. and said, well, I'm too young. And everyone tells me that, before 45, it shouldn't happen. And you get invalidated and the doctors say you're too young for HRT.
Yeah, we continue to do research on premature ovarian insufficiency. So failure of your ovaria leading to perimenopause early. Of course, it must go with early onset of HRT. HRT is important for not only your cognition and mood, but also for the heart. And there we come to the story of the female heart during menopause. That's at stake because first, cardiac heart attack is the cause of death in women, number one. And this is not known. People think it's breast cancer, but it's cardiovascular disease. And we found out in the outpatient clinic of a cardiologist here in the Netherlands with whom I cooperate, and who was intrigued by how many ADHD women she saw in her outpatient cardiology clinic. And I said, if that's true, we have to screen now, immediately, because lives are at stake. I'm a bit dramatic sometimes, but it helps to get things done. So she did, and she was very committed. And Janneke Wittekoek is her name. And she is a defender of the female heart. It has other problems than male hearts, and for recognition of the female heart. And we found that in the 300 women that we screened for ADHD, that 35% screened positive. So that's a high number. And it's only screening, it's not assessment. And for assessment, we need more time. But all the women she referred to me for cardiac complaints and ADHD treatment, they did have it. And it's not saying everything, and we have to do more research. But this was the very reason we also started the H3 network in the Netherlands, Head, Heart and Hormones, for the connection between psychiatry, cardiology, and gynaecology, because those women who had heart problems and ADHD were all in perimenopause. And those women with ADHD were younger than the others with these complaints, 2 years younger. So that means that the risk comes earlier for women with ADHD, and this could very well be explained by early menopause in women with ADHD. This has to be combined in another study, but I think we find some directions here. And what does this Head, Heart, Hormones network do? We educate the public, we educate our colleagues. We want to form regional little cells of the H3 network so that psychiatry, cardiology, and gynaecology voluntarily come together and start working together for the sake of women with ADHD and potentially also for other women with psychiatric disorders, because we assume it's not unique for ADHD to have this combination of interactions in the brain. Because estrogen protects the heart. So it's not a good idea to stop too early with estrogen and progesterone, because it protects the heart, it protects the bones, it protects mental health. And that's why women with psychiatric problems, including ADHD, suffer more when estrogen drops.
So I hope you enjoyed listening to this shorter episode of the ADHD Women's Wellbeing podcast. I've called it the ADHD Women's Wellbeing Wisdom because I believe there's so much wisdom in the guests that I have on and their insights. So sometimes we just need that little bit of a reminder, and I hope that has helped you today, and look forward to seeing you back on the brand new episode on Thursday. Have a good rest of your week.